First of all, thank you for coming to the central government offices. I and 4 principal officials, as well as colleagues from relevant departments, attended the Mainland Hong Kong thematic meeting on the COVID-19 epidemic in Shenzhen today. The meeting was chaired by Mr. Huang Liuquan of the Hong Kong Macau Affairs Office of the State Council, and then Mr. Sun Yang, Mr. Li Daqing, and then from the liaison office, Ms. Yuan Qinhua, and then Guangdong Province Governor, and also other Secretary Generals of the Shenzhen Municipal Government attended the meetings. At the meeting, Mr. Huang conveyed the concerns of Mr. Han Zheng, Vice Premier, and Mr. Xia Baolong about the epidemic in Hong Kong. For the healthcare workers, those involved in prevention and control of the disease, civil servants and discipline services and others involved in fight against the virus, they pay their tribute to all these people. And then Mr. Huang said that the Mainland authorities will give full support to Hong Kong in its fight against the virus in this 5th wave of outbreak. And the central authorities would like the SAR government to take all necessary measures to keep the epidemic under control. So I thank them for their concerns, and I also stated that the SAR government will put people's lives first and public safety first, and we will adhere to the target of dynamic zero infection, because this is best suits Hong Kong's situation. Also, I express my heartfelt gratitude to the Guangdong Province Government and the Shenzhen Municipal Governments for their support. And Mr. Li He, Secretary General, said that we are the same family. If we help Hong Kong, we're actually helping Guangdong Province as a whole. So for Guangdong Province and the Shenzhen Municipal Government, they have tried their best to ensure the supply of goods, fresh produce, vegetables, meat, and so on to Hong Kong. They want to make sure that we have a stable supply of daily necessities, and I express gratitude to them for that effort. The National Health Commission experts have confirmed the hard work of the SAR government in the past 2 years in fighting the virus. Now, because Omicron is highly transmissible, so in terms of resources and facilities, Hong Kong experienced difficulties in coping with the epidemic. So there's a need to address these bottleneck issues. The SAR government put forward requests for various assistances. First, to deploy Mainland experts to Hong Kong to help us with the genetic sequencing and so on for the virus. 2, to boost our testing capacity. 3, to help with the construction of isolation and treatment and quarantine facilities. 4, to provide rapid antigen test kits. 5, to provide hospital beds, masks, and other protective gear, as well as in the fight against the virus. The National Health Commission, the Guangdong Provincial Government, and the Shenzhen Municipal Government expressed their willingness to offer assistance and support. So there was an active and positive discussion at the meeting, and we exchanged views on various issues, including the direction of our work. And then we've achieved the following at the meeting. Firstly, the central authorities will actively consider the request for assistance from the SAR government. In principle, they accept all our requests for assistance. Secondly, the central authorities and the Guangdong provincial government will take measures to make sure there is a stable supply of daily necessities, including vegetables, fresh produce, and so on, to Hong Kong. Thirdly, the Guangdong provincial government and the Shenzhen municipal government agreed to set up a joint expert team so that we could take a targeted approach in addressing these issues. So there will be a group of communicable disease experts. 2, there's a group on experts on testing. 3rd, there is a group of experts on quarantine. 4thly, there is a group on supply of medical supplies and so on. So these various groups will be formed very soon, and they will come up with various strategies. Now, attending the meeting today, we have the Secretary for Food and Health, Secretary for Food, Transport and Housing, Secretary for Constitutional and Mainland Affairs, and Secretary for Security. They will be actively following up on all issues under their jurisdiction. The Secretary for Transport and Housing will follow up on the stable supply of supplies and so on. And then the Secretary for Constitutional and Mainland Affairs will follow up on liaison matters, such as liaison with the various task forces. And then the Secretary for Security will follow up on the cross-boundary arrangement for the personnel and supplies. I have given a verbal report to the Chief Executive. I will be coordinating all such efforts. So questions are welcome now. If you want to ask question, please limit it to 2 questions each. And please use the microphone we will pass you before you speak. In the middle there. I'm from cable TV. For the inflatable laboratories, we need at least 2 additional ones so that you could achieve the daily testing capacity of some 300 to 400,000. Now, there are some confirmed cases who've waited some 6 days to be admitted to hospital. So is the public healthcare system on the brink of collapse? Will you ask people to isolate at home? And we have an additional 1,000 cases each day. So would the central authorities still require us to adhere to the dynamic zero infection strategy? Is it still feasible? And do you have plans to have a lockdown? Now, first of all, at this stage, we have no plans for a city lockdown. When we had discussions with the mainland experts, we had detailed and serious discussion about boosting our testing capacity. We considered various options for giving us assistance. For example, if mainland personnel is to be sent to Hong Kong to boost our testing capacity, then we discussed how much more manpower we need and what sort of supporting measures are necessary. We also considered whether it's possible for some of the tasks to be taken up on the mainland as backup operation. Of course, there are different circumstances, so there's why different options were considered, and it's for this reason we agreed to set up expert groups so that we will decide what would be the most effective strategy to boost our testing capacity as soon as possible, and at the same time to take advantage of the advantages the country has. So we'll find ways to come up with effective measures to respond to the current epidemic situation. Now, for confirmed cases which could not be sent to hospitals for treatment in a timely manner, yes, we are aware of that situation. And that's why when we exchanged views with the mainland, we agree that Omicron is highly transmissible, and that's why there are bottleneck issues involving certain facilities. So we are under pressure, and we are fully aware of that. And that's why we need to address these bottleneck issues. And we need to build the relevant facilities so people could be sent to these facilities at the first instance without having to wait for a long time. And in my opening remarks, I made it clear that our top priority is to protect the lives of people and to make sure that public health is protected. So dynamic zero infection is the best way to achieve that, because with dynamic zero infection, we will be able to ensure that people's lives are protected, and then our public healthcare facilities will work effectively. So that means we will have targeted approach to make sure that the various measures could be implemented effectively.
Next question to the right, front row. Good evening, I'm CGTN. The spokesperson of the Hong Kong and Macau office said that the central government would offer full support for Hong Kong's government's fight against COVID to ensure the supply of necessities and other goods to Hong Kong. Are there the specifics about how this will be done? For the SAR government, how would the SAR government do its part as part of the central government support? What measures will be rolled out as the next stage to ensure the supply of necessities and everything will be okay? The second question, in terms of the support from the central authorities, after all these measures come out, how would you appeal to all sectors of Hong Kong to reassure them and get them to support all these measures to ensure we can get a victory over the fifth wave of outbreak? Regarding the support and the material support from the Guangdong and Shenzhen authorities. At the meeting, we are of the same mind. All the necessary support will be provided. In terms of the request for assistance we put forward, we laid out some figures in terms of the kind of things we need. As for the special expert teams, they will look into the specifics about how to roll out the measures. There are certain things we agreed on, such as the provision of rapid test kits. These are things that we agreed on. There's also something on helping the SAR government construct isolation and quarantine facilities. These are things we agreed on. And something else that could be achieved quickly, we put forward a request about the supply of materials, personal protective equipment, hospital beds, and masks. These things will be made ready and provided to us quickly. At different stages, certain things can be provided sooner, and other things will take more time to get ready. In considering these things, we put forward proposals. There may be other better proposals along the way. So that's why we're taking this approach involving special expert teams to sort things out. At different stages, the Guangdong provincial authorities and the Shenzhen municipal authorities will provide different kinds of assistance, and with their help, I believe, we will be in a better position to contain the outbreak. As for the Hong Kong's public, at all times, I hope the public can stick to our anti-COVID measures, put on masks, maintain good hygiene, and maintain social distancing by avoiding cross-family gatherings. Next question. At the right to the back, the lady over there.
Morning Post. Good evening, and thank you for coming after the long meeting. My first question is about, so we have confirmed that there will not be any lockdown. Can you elaborate a bit more about the task force that is going to be set up to help Hong Kong? Does that entail that personnel will be coming to Hong Kong to speed up the genetic processing of COVID-19 samples? And for my second question is that the discussions today were mainly focused on tracing, testing, and isolation treatment. did the mainland provide a timeline on vaccinating the population, given that the situation with 42 different elderly care homes having cases is also very severe at the moment?
I seem to have heard that you asked about lockdown. At the present moment, we don't have this plan because we believe that with the enhanced measures that we have introduced, it will take its effect because we have just introduced some tighter social distancing measures. And also, with the assistance from the mainland, we believe that our capability will be increased, and we will be seeing positive improvement in those areas. Regarding possible arrangement for mainland people to come to Hong Kong for our assistance, this is a subject of discussion. It is agreed that if there's a need for some personnel to come to Hong Kong to help us boost up our testing capabilities, then this definitely will be an area that the mainland authorities will likely consider and give assistance in. But the thing is, there are several options that we discussed during the meeting. We are very grateful to the mainland experts and colleagues who have highlighted where their strengths are and how these strengths can be preserved even if they are offering assistance to Hong Kong. Obviously, how things are run and practiced in the mainland may have to be modified a little bit if it is to be applied in Hong Kong. That modification may or may not affect the effectiveness or efficiency of the whole arrangement. So there may be possible areas that some of the strengths in the system can be maintained by dividing responsibilities and functions between what are those that are best to be taken in Hong Kong and what are those that may best be done as background support in the mainland. That is the reason why we establish all these special task force to examine the technicality, the possible options, and the best implementation plan. We all agree that this should take place immediately. And that is why I have already reported to the Chief Executive, who has already directed that we will all proceed to examine all these options immediately. And I, for example, will be talking and discussing with government officials of different bureaus and departments to take forward the different task force subjects so as to make sure that things will progress ASAP.
下一位提問，邊後排。
Next, to the left there, back row. Now, the government's seeking assistance from the central authorities. So how many people are they sending to Hong Kong to help in our fight against COVID? And have you asked for assistance for the construction of something like the Huo Shen Shan Hospital, a field hospital? And what will be the location of that hospital? Now, in my reply earlier to a question about how we could boost our various capacities and increase our facilities. Now, the Guangdong Provincial Government, Shenzhen Municipal Government, and the Hong Kong SAR Government agreed there are various ways to help Hong Kong address the various issues. Sending people to Hong Kong is, of course, one of the important solutions. But then we also discussed various practical operations. And so different personnel may have to be sent to Hong Kong from the mainland, because we want to tap into the strengths of the mainland systems so that it could provide the best assistance to us. So we have considered various options. We have considered the number of people to be sent here. So the experts will consider all these various options and see which is the best one. And then we'll see how many people need to be deployed and so on. So the task forces will study all these issues, and then we will make an announcement on providing additional facilities, such as healthcare facilities, testing facilities, or any infection control facilities. Well, we have asked for assistance to help us build these various facilities. As to the scale of these facilities and the location of these facilities, the task forces will, of course, study all these issues as soon as possible, and then they will come up with some options for implementation. To the left, in the middle, or in the front row, I'm from Now TV. Now, you said that at this stage there is no plan for city lockdown. But then many are worried, and so they went to go shopping. So if you have no plan to implement lockdowns, then when would you do it? In your discussion with the mainland experts, you talk about ensuring the steady supply of fresh produce and so on. Now, the experts have said that we haven't yet seen the peak of the epidemic. It will be next month. So how many cases would, what is the threshold for a lockdown? How many cases are we talking about? Now, we are not going to consider a lockdown. The World Health Organization said the lockdown is the last resort. We don't believe we need to consider a lockdown. We are confident in one aspect, that is, our existing measures are going to work, because we've only recently launched a series of stringent anti-epidemic measures, including social distancing measures, the banning of multi-household gatherings and so on, involving more than 2 households. So we believe these measures will work, and then we're also going to boost our various capacities at the same time. In our discussion with the mainland experts, we find that our anti-epidemic strategy is the same as that of the mainland. So we need to ensure there's early identification, and then we have to control the various neighborhoods or blocks or individuals. And then we must also try to administer treatment as soon as possible. Now, we're seeing the current situations because Omicron is highly transmissible, and so there are bottleneck issues involving some of our facilities. If we could address these bottleneck issues, then we believe we will be more effective in controlling the epidemic. That's why we have no such plan. Next, please. On the right, the gentleman in blue. I'm from Commercial Radio. Now, the SL government has asked for assistance on various fronts. So, have you decided what will be covered by either the central authorities or the SL government in terms of expenditure? And then you say you are going to do experts will help with investigation and so on. So what is the division of work between the Central Center for Health Protection and the mainland experts? Now, we've asked for assistance and we've received positive response from all parties concerned. And, the question of funding was not even an issue we considered, but rather we considered what would be the best way to control the epidemic. In terms of funding, well, that's not our priority consideration. That's the agreement of all parties. On the investigation and so on of infectious disease, Professor Sylvia Chen will respond to that. Well, yes, we are seeing serious situation with the Omicron variant strain, and we are, actually working very fast and to trace infection sources and investigate cases. But then we need to do more detailed analysis because we know on the mainland there are many experts on epidemiological investigation. So in terms of public health and infection control, we could have more in-depth exchanges with mainland experts. That's why we would like these experts to come to the Center for Health Protection, and they could work with our colleagues to do further analysis on the various data and information. Last question. On the right, the gentleman in white at the back. I'm from TVB. About these task forces, there are going to be 3. When will they be set up? And who may become members of these task forces? Now, about the rapid antigen test kits, RAT kits, how many kits will be provided to us? And when will you be distributing the kits? Because there's a plan to distribute a kit to everyone in Hong Kong. And then on isolation facilities, there is a shortfall. So how many units are you going to build? And then at the meeting, did the mainland officials suggest that you should be implementing even tougher infection control measures? Now, for task forces, there are 5. They cover members from 3 parties: the Guangdong provincial government, Shenzhen municipal government, and the SAR government. And then we will do in-depth studies on 5 different topics, and then we'll come up with some measures. For example, in some cases we will need to build facilities, and then also there's the need to provide supplies, and we need to do it quickly too. So whenever we come up with an measure, we'll implement it at once. On any testing arrangement, of course, we will look at our capacity, and we will try to do tests as far as possible. And that's why we're now asking the central authorities to help us boost our testing capacity. In Hong Kong, we could do about 200,000 tests a day. So we want to boost our own capacity. So within this month, we'll be able to do 300,000 tests a day. But there's need to increase that number further. The more, the better, actually. But in actual operation, we have to consider the manpower requirement, the support facilities, and so on. And so we need experts to consider these matters. But the target is clear. That is, we need to boost our testing capacity. That is for sure. And we need to actually increase our testing capacity in multiples. So we're looking at different figures, and then I believe after the task force is set up, they will study the matter as soon as possible, and they will make an announcement. Thank you. That's the end of the media session.